One-and-done treatments could cost your patients real recovery, especially in complex spine cases.
The patients that I see with spine issues have multi-level, multi-structural involvement. And sometimes it's just hard to get it all in one session.
So how do you plan follow-ups ethically? Let's talk strategy.
When you were talking about like a touch-up, do you include that with all of your patients? Do you have a certain subset of patients that always are in the realm for touch-up?
Majority of my patients who do need a series are my spine patients.
Okay. Tell me a little bit more about that.
Yes, because almost always the patients that I see with spine issues have multi-level, multi-structural involvement. And sometimes it's just hard to get it all in one session, although you're already doing like 20 shots in one session.
Right.
Yeah, sometimes they do need to come back to get that done. So I can kind of identify those patients that I know would need a second or a third. And so I would price it as such. If they're coming, in a series of 2 or a series of 3, then, they will have a better price than, if they just do it one at a time.
And how far apart do those, are you putting those? Are you signing them up for a series of 3 and then if they're great, they kind of...
For the spine, usually I do it every month because I've done it before as early as the 2nd week and they're still kind of a little sore from that treatment. Especially
I've read, I've read some studies that show that if you repeat the epidural at 6 months, we have better outcomes. Is that something that you found?
I mean, if I'm going to repeat an epidural, I'm going to repeat it way sooner than 6 months. I'm not going to wait for 6 months. The only patients that I would probably wait for 6 months are those kind of one level, epidural wherein they have one disc herniation that's impinging on one nerve root. Then let's give you a good number of platelets in that level, blast that area, and then come back. Usually my follow-up is 4 to 5 months just to check in for spine, and then if they are not quite where they want to be, then we schedule it for a booster shot.
Gotcha. Awesome. Don't miss out. Please subscribe to our newsletter now to stay ahead of the world of orthobiologics. You can find the link below. Additionally, if you're ready to start this journey with me in my orthobiologics masterclass, come join us.